You will be shocked after hearing this. If Ayurveda is such an ancient and time tested science, then why do so many people, even in India, hesitate before taking Ayurvedic medicines? Why do doctors and patients face doubts, confusions, or even resistance when it comes to Ayurveda in daily practice? Today, I am going to uncover the top 10 practical challenges patients and clinicians face with Ayurvedic medicines. And I will also give you practical solutions for it. By the end, you will see the real problems and the hope for Ayurveda's future. Namaste, I am Dr. Hitesh Chaudhary, and for the past 12 years, I have been practicing Ayurveda alongside modern medical insights. Now, let's be clear, Ayurveda is not just an alternative or a set of home remedies. It's a complete medicinal science. But yes, when it comes to practical day to day medical uses, there are hurdles. So let's go step by step and understand what makes patients hesitate, what challenges clinicians face, and most importantly, how we can overcome them. So, number one is product quality and contamination. One of the biggest concerns is quality variation. Sometimes herbal medicines are not processed properly, or worse, contaminated with heavy metals or adulterated with synthetic drugs. Solution for this is patients should only buy medicines with GMP certified or Ayush certified labels, and clinicians should recommend brands with transparent lab testings. This ensures both safety and trust. If clinics are manufacturing their own medicines, then those should be properly monitored and tested. Standardization and dosing issues. In Ayurveda, doses are traditionally given in ancient measures like Pala or Anjali. But modern patients and doctors want in milligrams, exact concentrations and validated potency. So solution for this is always use products that come with the clear dosage instructions in modern units. And practitioners must adapt classical measures into practical equivalents for today's patients. But do remember, efficacy should not be hampered for convenience. Problem number three is herb drug interactions. Many patients today are on long term medications. If they also take Ayurvedic herbs, there is a risk of interaction. Some incidences are also reported in different research journals. Solution for this is patients should never self-medicate. Always disclose all ongoing medicines to your doctor, and clinicians must cross-check with interactions databases and growing pharmacology research before prescribing. We come to the problem number 4, that is slow onset of results. Generally, it's misunderstanding of patients that Ayurvedic medicines act slow for the disease. Up to some extent, it's true, but that depends on patient's immunity and response, the disease stage, and many other factors. They focus on root cause healing, which takes weeks to months. Solution for this is doctors should set realistic expectations. Patients must be told upfront that Ayurveda is a long-term investment in health, not a quick fix pill. Problem number 5, weak pharmacovigilance. In allopathy or modern medicines, adverse drug reactions are tracked systematically. In Ayurveda, this system is still growing. Solution for this is patients should report any side effect immediately, and doctors should document and share it with official Ayush Pharmacovigilance Center. This makes Ayurveda safer for everyone. Here we come to the challenge number 6, that is over-promising and misinformation. Some companies, social media influencers, and even practitioners advertise Ayurveda as a guaranteed cure for everything. Such exaggerated claims damage credibility. Solution for this problem is patients should trust only evidence-based practitioners, and clinicians should educate responsibly, highlighting both strengths and limitations of Ayurveda. Honesty builds long-term trust. Here we come to problem number 7, that is cost and accessibility. Authentic therapies like Panchkarma requires weeks of treatment and can be expensive. On the other hand, cheap over-the-counter products may compromise quality. Solution for this is patients should look for customized, affordable outpatient therapies, and policymakers need to expand insurance coverage for authentic Ayurvedic treatments to make them more accessible. Problem number 8 is lack of clinical guidelines. Doctors often ask, if my patient has multiple diseases, how do I integrate Ayurvedic care safely? Solution for this is, until global guidelines develop, practitioners should use case-based protocols and collaborate with allopathic doctors for patient safety. Research institutes must work towards publishing standardized guidelines. Problem number 9 is regulatory differences across countries. In India, many Ayurvedic products are recognized as medicine, but in the US or Europe, they are sold only as supplements. For this, the solution is, patients should check the legal status before traveling. Clinicians abroad can suggest locally approved alternatives, while global regulators and Ayush must continue working on harmonizing standards. Here we come to the last problem, that is 10th, patient confusion and mixed messages. Some videos claim miracles, some doctors dismiss Ayurveda, and research shows mixed evidences. So what to do? Patients don't know whom to trust. And what is the solution for this? Patients should rely on qualified Ayurvedic doctors and certified clinicians. Peer-reviewed information, not social media hype. Clinicians should use simple communication to explain what Ayurveda can and cannot do. So these are the 10 biggest practical challenges and their solutions in taking Ayurvedic medicines. Does that mean Ayurveda is weak or alternative medicine? Absolutely not. It means we need to strengthen quality control, improve evidence, educate patients, and modernize the way we present Ayurveda. The good news is this transformation has already started with India's Ayush Ministry, WHO's traditional medicine strategy, and growing clinical research. Ayurveda is moving closer to the global acceptance. And remember, Ayurveda is not about quick fixes. It's about balance, prevention, and sustainable healing. If we adapt wisely, Ayurveda can shine as one of the greatest healing sciences for the world. Thank you for watching. If this video gave you clarity, please do share it. Subscribe to this channel. Let's spread awareness that Ayurveda deserves not blind faith, not blind rejections, but respect, research, and responsible use. Thank you.